Hello everybody. Today we're going to talk about the Thoracic Outlet Syndrome or TOS. We're going to discuss the disease itself, the clinical presentation, the diagnostic tools that we use to figure out the disease, and finally we're going to talk about the treatment options available for this peculiar disease. First of all, what is Thoracic Outlet Syndrome? Basically, it's a disease, it's a clinical syndrome associated with a compression of the nerves and blood vessels in the thoracic outlet area, which is right here. Basically, depending on the compressed element, there are three distinct clinical variations of Thoracic Outlet Syndrome. Most commonly, we see neurogenic form associated with the compression of the nerves. Rarely, we see venous form when subclavian artery is being compressed and the flow is being obstructed. Very rarely, approximately in 1% of cases, we see obstruction or compression of the subclavian artery with consequences. When it comes to clinical presentation of TOS, it depends on the clinical variant. Most commonly, as I said, we see neurogenic form in more than 90% of cases, and in those cases, the major clinical presentation is pain. Pain in the shoulder area, in the root of the neck, that shoots down to the arm, and associated also with numbness and weakness in the arm and hand. Typically, the pain goes all the way down along the inner part of the arm toward the fourth and fifth fingers, but sometimes the entire hand and all fingers could be affected. Also, we see the numbness and the weakness in the hand and in intrinsic muscles of the hand. Very frequently, we see pain radiating to the chest, back of the neck, and upper shoulder area, as well as from the occiput all the way to the head, even to the face and around the eye. So, when we see compression of the subclavian vein, we frequently observe symptoms like swelling and the cyanosis, which is a bluish discoloration of the hand and arm. If arterial TOS is present, then we see the paleness and the intolerance to cold. When it comes to diagnosis of Thoracic Outlet Syndrome, the most important step is to suspect Thoracic Outlet Syndrome. And unfortunately, most physicians are not aware or not familiar with Thoracic Outlet Syndrome. That's what we see very frequently. Patients usually see many doctors and get many different diagnoses, which most of the time are irrelevant, and sometimes they get treatments which most of the time are ineffective or even harmful. So if clinician suspects Thoracic Outlet Syndrome, he or she can perform a number of tests, perform the neurological examination to check for a sensitivity and motor weakness in the affected site. Also can perform several provocative tests to see if those tests provide any clinical insight. If there is a strong clinical suspicion of Thoracic Outlet Syndrome, the patient is usually referred for the radiological examination. And I have to tell that in most cases, there is no single test that can accurately diagnose Thoracic Outlet Syndrome. We usually use a number of radiological assessments to basically verify the disease. Usually those tests include X-ray examination of the neck and shoulder to see if there are bone and abnormalities, CT scan, especially with a 3D reconstruction, MRI of the spine and the brachial plexus, and electromyography or EMG studies to see if there are any nerve conduction problems in those patients. And after we receive all the information, we can more or less, with a certain level of assurance, can say that there is a thoracic outlet syndrome present or absent in this patient. Unfortunately, as I mentioned earlier, there is not single test, reliable test that can diagnose the disease. When it comes to treatment, mild and moderate cases can be treated conservatively, which means physical therapy, relaxation, sometimes chiropractic manipulations, and medical treatment. However, in most cases, TOS is caused by anatomical abnormalities like extracervical rib, accessory rib, or fibromuscular bands, which cannot be treated with those methods. So the surgery plays a very important role in treatment. So there are several surgical treatment options for this disease. Usually, but the thoracic surgeons are most frequently involved in the patient care in thoracic outlet syndrome. They may perform surgery from armpit, the surgery type of surgery that we call the transaxillary approach, or supraclavicular approach when the surgery is performed from the front and above the clavicle. And surgery usually involves removal of the significant portion of the first rib as much as possible and relieving the pressure from the nerve and vessels. However, in most cases, the rib removal is not possible, is not feasible, and the remnants of the rib, especially at the deep portion, at the portion when the rib is attached to the spine, are left, which may cause recurrence. I developed an alternative approach. I do surgery from the posterior when the rib can be totally removed, starting from the head of the rib, starting from the spine, all the way to the clavicle. And in addition to that, there is also possibility to explore and see if there are any additional elements compressing the neurovascular bundle. That's all for today regarding this peculiar syndrome, which we call thoracic outlet syndrome. If you have further questions, please do not hesitate to contact us. Thank you very much.